This is Dr. Samal Yazad. What I'm going to do today is that go over the pelvic bone and some of the marking on the pelvic area. You can see this is a structure. This is a human pelvic that it is composed of two parts that are posteriorly attached to the sacrum and anteriorly attached by way of this joint known as the symphysis pubis. Each section of the pelvic is known as ox coxa, which produce this for us. It's composed of three bones. The upper part is known as the ilium, the lower part is known as the ischium, and this section here is known as the pubic part. The connection of these three bones produce this little hole known as acetabulum. And acetabulum is an area where the head of the femur is going to be attached to, which extends right to your legs. Looking at the ilium first, you can see this section. This is known as iliac crest, which is the part that when people stand up and put their hands on their hip, pretty much you put your hands on this section. As you come down to the anterior and a little bit inferior, you have the first bump. This one is known as the anterior superior iliac spine. From there you go a little bit lower, you get to anterior inferior iliac spine. Then you have the iliac fossa right here, and come to the back, you're going to have the same bumps. One bump here which is known as posterior superior iliac spine. The other bump is known as posterior inferior iliac spine. Continuation of this one produces this huge curve or notch known as the greater sciatic notch. Greater sciatic notch will come and ends at this little spinous process which is known as ischial spine. From there, it's going to go to the lesser sciatic notch, and now we are in an ischium area. This is known as ischial tuberosity. When you sit, you're pretty much sitting on this bone on your rear end. Then this one is going to be extending a little bit forward. From here on becomes pubic. So this has become the inferior pubic ramus. The upper part is known as the superior pubic ramus. The connection of the ischium and pubic produce this hole which is known as the obturator foramen. And that's pretty much is going to be covering the thing that you need to know. Thank you for watching.